In 2024, what was the leading cause of death for children in the United States?
In 2024, firearms remained the leading cause of death for children and teens in the United States, continuing a trend that began in 2020. This alarming statistic persisted for the third consecutive year, surpassing other causes such as car accidents and cancer. Key findings: firearms were responsible for approximately 18% of deaths among individuals aged 1 to 18 in 2022. About 3,500 young lives were lost due to gun-related incidents in 2022, equating to roughly 5 fatalities per 100,000 children nationwide. The gun death rate among children and teens more than doubled since 2013. Disproportionate impact. The impact of gun violence on children and teens was not evenly distributed. Black youth aged 1 to 17 had a gun death rate 6 times higher than their white counterparts. The gun homicide rate for Hispanic and Latino children and teens increased by 70%. Black children and teens faced a homicide rate 18 times higher than their white peers. Types of gun-related deaths. Among children and teens who died from firearms, approximately 70% of gun deaths in this age group were homicides. Other causes included accidents and suicides. This ongoing crisis underscores the urgent need for effective strategies to address gun violence and protect the lives of children and teens in the United States.
What measures are being taken to reduce gun violence among children?
Several measures are being taken to reduce gun violence among children in the United States, as this issue remains a critical public health concern. Here are some key initiatives and strategies. Prevention programs. The Know the Signs programs teach students and educators to recognize warning signs of potential violence and seek help. Start with Hello program aims to minimize social isolation and create more inclusive school communities. Say Something program teaches youth to recognize crisis warning signs and report them to trusted adults. The Choose to Change C2C program in Chicago provides behavioral and mental health support to young people at risk of gun violence. Legislative and policy measures. Implementing secure storage and child access prevention. CAP laws to hold gun owners accountable if children access unsecured firearms. Enacting extreme risk laws, also known as red flag laws, which allow for temporary removal of firearms from individuals deemed a risk. Raising the minimum age to purchase semi-automatic firearms to 21. Supporting legislation that limits access to guns, as states with stronger firearm access and safety laws have lower rates of firearm deaths. Healthcare initiatives, incorporating proactive gun safety conversations into clinical care, including education about safe storage practices and mental health screenings. Partnering with communities to implement interventions such as gun lock distribution, violence interruption, and gun buyback programs. Providing support programs for victims of violence to help prevent re-injury. School-based approaches, fostering safe and supportive school climates that address underlying factors contributing to violence. Implementing trauma-informed and grief-sensitive crisis intervention practices. Creating multidisciplinary teams to evaluate and design interventions for students in crisis. Research and advocacy. Continuing federally funded research to understand risk factors for children's gun injuries and deaths. Advocating for gun violence prevention through testimony to legislative committees and public awareness campaigns. Community engagement, forming coalitions between healthcare providers, businesses, and community organizations to address gun violence. Launching public health messaging campaigns on safe gun storage. These multifaceted approaches aim to create safer environments for children by addressing the complex factors contributing to gun violence. By combining education, policy changes, healthcare interventions, and community engagement, stakeholders are working to reduce the impact of gun violence on America's youth.
Is the Trump administration implementing any policies that can help with gun-related deaths for children?
Based on the available information, the Trump administration is not implementing policies that are likely to help reduce gun-related deaths for children. In fact, several actions taken by the administration may potentially increase risks. Rollback of gun safety measures. President Trump signed an executive order directing the Attorney General to review and potentially undo gun safety policies implemented during the Biden administration. The administration shut down the Office of Gun Violence Prevention shortly after taking office. School safety concerns. The Trump administration disbanded the Federal School Safety Clearinghouse External Advisory Board, which was created to share resources and best practices related to school safety. Trump has proposed arming teachers and putting more guns in schools, which is opposed by many gun safety advocates. Regulatory changes. The executive order calls for reviewing and potentially weakening federal oversight of the gun industry, including the Bureau of Alcohol, Tobacco, Firearms and Explosives, ATF. There are plans to allow states to use federal money allocated for low-income school districts to arm teachers instead. Previous term record. During Trump's first term in office, guns became the leading cause of death for children and teens in America. The administration narrowed the definition of who is considered a fugitive from justice for gun purchasing purposes, potentially allowing more individuals with outstanding warrants to buy guns. Gun safety advocates argue that these policies and actions are likely to increase risks rather than help reduce gun-related deaths among children. The administration's focus appears to be on expanding gun rights rather than implementing measures specifically aimed at reducing gun violence affecting children.